Let's talk about contraception. Have you ever looked at all the birth control options out there and just felt completely overwhelmed? Yeah, you are definitely not alone. So in this explainer, we're going to break it all down, from the science behind it to how you can find the perfect fit for your life.
Hey everyone, and welcome to MediByte. We're so glad you're here. Our whole goal is to give you clear, reliable health info so you can feel confident in the decisions you make for yourself.
So if you're thinking about birth control, it can feel like there are a million choices and it's hard to know where to even start. But don't you worry, that's exactly what we're here for. We're going to break it down together. Okay, so first things first, what is contraception really? Well, in the simplest terms, it's any method used to prevent a pregnancy. And it does this in one of a few really clever ways. Some methods stop an egg from being released in the first place. Others block the sperm from ever reaching the egg, and some prevent a fertilized egg from implanting.
To really get a handle on all the different options, it helps to peek behind the curtain a little bit and look at the science. Understanding how they work makes everything else click into place.
So you can think of it like this. Every contraceptive method has a main strategy, and they usually fall into one of these three. The first strategy is to tell the ovaries, hey, take a break, so they don't release an egg. The second is to create a physical roadblock, literally stopping sperm from getting where they want to go. And the third is a bit more sneaky. It thickens the cervical mucus, creating a sticky trap that sperm just can't get through.
See? Knowing those basic strategies makes it so much easier to understand the different types of birth control. So let's group them into a few main categories to make it even clearer.
First up, we've got hormonal methods. Now, these are super common. They use synthetic versions of hormones your body already makes, like estrogen and progestin. By tweaking these hormone levels, they basically send a signal to your body to not ovulate. No egg means no chance for fertilization.
And this category covers a lot of ground. You've got the classic daily pill, a patch you change weekly, a ring that works for a month, a long-acting implant, and even an injection you get every few months. Lots of variety here.
And this slide really shows the huge difference in user experience, even within the same category. You have the pill, which is fantastic, but it requires you to be on top of it every single day. Then you have something like the implant, which is what we call a set it and forget it method. A doctor places it and boom, you're covered for years. No daily reminder needed.
Okay, let's move on to our second category, barrier methods. The name pretty much says it all, right? These methods work by putting up a physical wall to keep sperm and egg from meeting.
We're talking about things like external and internal condoms, which you can find pretty much anywhere, and also other options like the diaphragm, cervical cap, and sponge, which are inserted before sex. Now, I really want to pause on this point because it is so important. Of all the methods we're talking about today, condoms are the only ones that also protect you against sexually transmitted infections, or STIs. That's a huge deal, and it's why they're often recommended even if you're using another form of birth control. It's about protecting your total health. Our third category is home to some of the most effective methods out there. IUDs, or intrauterine devices. These are tiny T-shaped devices that a doctor places in the uterus. They're a type of LARC, that stands for long-acting reversible contraception, which is just a fancy way of saying they work really well for a long time, but you can have them taken out whenever you're ready to think about pregnancy.
And with IUDs, you've got two main flavors. There's the hormonal IUD, which releases a small amount of progestin and can make periods lighter or even make them stop. They last for about 3 to 8 years. Then there's the copper IUD. It's totally hormone-free and can last for up to 10 years. But it can sometimes make periods heavier, especially in the beginning.
Okay, so we've covered the what and the how. Now for the million-dollar question, how well do these things actually work? Let's talk about effectiveness.
To really get this, we have to understand two super important terms, perfect use and typical use. Perfect use is like following a recipe perfectly, every single time, without mistakes. Typical use, well, that's real life. It accounts for us humans forgetting a pill or not using a method correctly every time. It's a much more realistic picture.
And wow, this table really drives that point home. Just look at the implant. Perfect use and typical use are exactly the same because there's no room for human error. But then look at the pill. The pregnancy rate jumps from less than 1% to 9% in the real world. For condoms and withdrawal, that gap is even bigger. It really shows how much our own actions can play a role. This chart just makes it crystal clear. With typical, real-world use, the risk of pregnancy with an implant is almost zero. With the pill, about 9 out of 100 people might get pregnant in a year.
For condoms, it's closer to 18. This is exactly why those set it and forget it methods, like IUDs and implants, are considered so incredibly effective. So, with all of this info, how in the world are you supposed to choose? Well, the truth is, there is no single best method. The best method is the one that's best for you. It's all about thinking about your own life. Are you someone who's great with a daily routine? How important is convenience? Are you worried about side effects? Or maybe excited about potential perks like lighter periods? Do you need that STI protection we talked about? And what do your future family plans look like? These questions are your starting point. But honestly, the single most important thing you can do? Talk to a healthcare professional. A doctor, a nurse, they can look at your personal health history, talk you through the risks and benefits as they apply specifically to you, and help you find the perfect match.
And that's really the bottom line here. The goal isn't to find some mythical best birth control. The goal is to find the method that fits seamlessly into your body, your life, and your future plans.
So, now that you're armed with a little more information about the science and all the options, maybe think about it for a second. What's the next step for you on your own personal health journey? We really hope this helped clear things up. If you found this explainer valuable, do us a favor and hit that like button, share it with anyone you think could use it, and of course, subscribe to MediByte for more straightforward health info. Thanks so much for watching.